Basically, AI spotting tumors. It really makes you think. And this is actually a subject close to the heart of Le Podcast de Philippe. Okay, let's really unpack this. Imagine a world, right, where artificial intelligence can spot these tiny, hidden tumors, maybe even before human eyes can. It's completely revolutionizing early cancer detection. It's a truly groundbreaking area. And yeah, we're diving deep into it today.
Precisely. In this deep dive, it's all about these, well, frankly, astonishing advancements in AI detecting various cancers. We've gathered the key insights from the sources you've provided. Our goal here is to really uncover the capabilities, how this tech is set to transform diagnostics, but also the crucial things we need to consider with such powerful innovation.
Right, the implications. And when you say incredible capabilities, some of the numbers are just staggering.
Yeah.
Take BrainMets.ai, for instance, developed by the Netherlands Cancer Institute and RoboVision Healthcare. This AI has get this, 97.4% sensitivity for detecting brain metastases. That means it's correctly spotting almost all actual tumors.
Which is critical.
Exactly. Even ones traditional MRI might miss. And what's maybe even more impressive, it hits 93% accuracy for lesions under 3 millimeters. Tiny, tiny things.
Yeah, spotting those incredibly early growths, seeing what was practically invisible before. And what's fascinating really is that this isn't just, limited to brain tumors. Look at the JAPI model from China's Asian Cancer Hospital, and Alibaba Demo Academy worked on this.
Okay, what's the focus there?
Early stage stomach cancer. Now, the big deal here is that it works from non-contrast CT scans. Usually you need contrast dye for that.
Right, which is always ideal for the patient.
Exactly. So this is huge for comfort, for accessibility. And the performance, 85.1% sensitivity, significantly better than human radiologists in their studies. It's actually deployed in hospitals now.
Wow. So it's already in practice.
Yes, and think about this. Nearly 40% of the cancers it caught were in asymptomatic patients, people who didn't know they had it, early detection and action. And then there's the Pandia model for pancreatic cancer. The numbers there are 92.9% sensitivity and 99.9% specificity.
99.9% specificity, so almost zero false positives.
Pretty much. It's incredibly good at ruling cancer out when it's not there. It even got that FDA breakthrough device designation. The potential to cut screening costs is massive.
These imaging AIs are amazing, but okay, here's where my mind was really blown. Non-invasive methods.
Yeah.
Like detecting cancer with just blood.
Ah, yes, the MyoNCoDex test.
Right. From the University of Southampton and XGenera, can apparently identify and pinpoint up to 12 different types of cancer: pancreatic, ovarian, lung, breast, prostate, colorectal. The list goes on.
12 types is quite a range.
It is. And with 99% accuracy, all from just 10 drops of blood, it analyzes these things called microRNAs.
Tiny genetic fragments, like molecular fingerprints for cancer.
Exactly. I mean, think about the implications. Non-invasive, quick results. You could potentially screen huge populations systematically.
And if you sort of zoom out from these specific examples, there is a big meta-analysis, Hussein et al., that looked across the board.
What did it find overall?
It basically concluded that AI-assisted diagnostic imaging, CT, MRI, mammography, you name it, significantly outperforms traditional radiology. Better sensitivity, better specificity, better overall accuracy. It was particularly strong for gastrointestinal lesions and cancer metastases. And crucially, it speeds up the interpretation time quite a bit.
So it's not just better, it's faster and more consistent.
Right. It's about speed, reliability, and reducing that human variability factor.
So how does this actually, change the diagnostic process? What's happening under the hood?
Well, fundamentally, these AI algorithms are crunching enormous amounts of data images, genomic info, clinical notes, way more than a human could process. They find these really subtle patterns. Think of it like giving clinicians superpowered analytical tools. It provides standardized assistance, which really helps with reproducibility. Some diagnostic tasks used to vary a lot depending on who was reading the scan.
Okay, so it standardizes things. And you mentioned speed earlier.
Yes, speed and precision. Take prostate MP MRI. That's a complex, detailed scan. AI can generate a 3D probability map of where the cancer likely is almost instantly.
Instantly. So reducing diagnosis time from days to what?
Hours, maybe even minutes in some workflows. It's a dramatic speed up. And AI isn't just detecting cancer that's already there. It's getting into prediction, too.
Yeah.
Like a 5-year breast cancer risk prediction. Farapixel has an algorithm similar to MIT's MIRI system, predicting risk even for women not usually considered high risk.
Wow, predicting future risk.
And even treatment planning, helping doctors accurately outline tumors for radiotherapy, making treatment more targeted.
So this tech has ripples across the whole healthcare system, doesn't it?
Absolutely.
You can see how it could tackle real-world problems like long waiting lists for scans or diagnoses, or even the staff shortages like radiographers. If AI makes things faster and more accurate.
It alleviates some of that pressure.
And there's the cost argument too, right? Catching cancer early with AI saves a ton of money compared to treating late-stage disease.
That's a major driver. Early detection is almost always more cost-effective.
I read about this concept too, one scan for multiple checks. Like Damo's pilots using a single CT scan to screen for several cancers and other things like osteoporosis.
Yeah, that multi-purpose screening idea is really powerful, maximizing the information from a single procedure. It's a big leap for preventative care, potentially.
Well, so the potential is clearly enormous, but there have to be challenges, right? It can't be all smooth sailing. Ethical considerations, practical hurdles.
Absolutely. And it's crucial we talk about these. The sources definitely highlight several key areas. First, there's patient privacy. AI thrives on vast amounts of sensitive medical data.
Right, so data security, breaches, that's a huge concern. People might hesitate to share data without rock-solid safeguards.
Exactly. And then there's patient autonomy. Could AI lead to treatment decisions without enough patient input? That erodes trust. Shared decision-making has to remain central.
Makes sense. The patient needs to be involved. What else?
Bias. This is a big one. AI is only as good or as unbiased as the data it's trained on. If the training data reflects existing health inequalities.
The AI will just perpetuate them.
Precisely. Like some studies found lower accuracy in breast cancer screening for younger women or Asian women, possibly due to higher breast density not being well represented in the initial training data sets.
Okay, so data diversity is key. And what about who actually benefits from this? Does AI reach everyone equally?
That's a critical point raised about equity and access, especially in screening programs. Often, these new AI tools first benefit people already engaged in screening.
So the people who might need it most, those who don't typically participate in screening, who often have worse outcomes, they might get left further behind?
That's the risk. Investment in fancy AI could potentially divert funds from, say, outreach programs or initiatives designed to increase participation among those non-attenders.
So how do we balance that?
One proposed solution is that AI interventions should ideally be cost-saving. And those savings, they should be reinvested specifically into strategies targeting those hard-to-reach, non-attending populations.
Okay, reinvesting the savings. That requires transparency, though. Knowing where the money is going.
Definitely. More transparency in investment decisions is needed. Maybe even quantifying the health benefits gained versus foregone for different groups, perhaps using methods like distributional cost-effectiveness analysis.
Interesting. So beyond the ethics and equity, what about the practical side of actually using this AI?
Well, there are practical and societal challenges too. Reproducibility is one. We touched on data quality, but small sample sizes or using data sets overly enriched with cancer cases can skew results, leading to false positives and making it hard to generalize to the wider population.
So we need really robust clinical trials in diverse real-world settings.
Exactly. And then there's the sheer technological lift. You need massive data storage, serious computing power, solid IT infrastructure, and people with specialized technical skills to build and maintain these systems. It's not trivial.
And you mentioned trust earlier, that black box problem.
Yes, the lack of transparency. If clinicians don't understand why the AI reached a conclusion, they might be hesitant to trust it, especially if it's working completely unsupervised. Building trust takes time and validation.
And liability if the AI gets it wrong.
That's a huge legal gray area right now. Who's responsible? The developer, the hospital, the clinician who used the AI's output. There's a bit of a regulatory vacuum still.
And finally, the impact on people, on society.
Right. There are understandable fears about job displacement for radiologists, although many see AI as more of a tool or a co-pilot. There's also the risk of over-reliance, where human skills might atrophy or automation bias kicks in.
Automation bias, like trusting the AI too much, even if it seems off.
Yeah, potentially missing nuances or accepting false positives because the computer said so. It's about finding that right balance between human expertise and AI capability.
So wrapping this all up, what's the big picture here? Our deep dive definitely shows AI has this, well, immense potential to revolutionize early cancer detection, make healthcare more efficient.
It really does. The analytical power is unparalleled. But what's truly fascinating, and maybe the key takeaway, is that the future probably isn't about AI completely replacing humans. Which leads to a question for you listening. Is the real breakthrough here actually a symbiotic partnership, where AI provides that incredible precision and speed, but human clinicians bring the crucial ethical oversight, the empathy, the context, and focus on tailoring care, especially for those underserved groups we talked about?
That's a great question to ponder. A human-AI team. And if you found this deep dive as fascinating as we did, you might also really enjoy Le Podcast de Philippe. It's a show we think you'll love. And speaking of support, please help us reach our goal of 1,000 subscribers. If you enjoyed this, share this deep dive with someone else who loves to learn.